I'm Dr. Olivia Parker, a board-certified urologist with over 12 years of experience helping men protect their sexual health, maintain confidence, and feel vital at every age. Today I'm going to share 6 science-backed methods to preserve and even maximize your manhood without pills, gimmicks, or false promises. Before we start, tap that like button, tell me in the comments where you're watching from, and subscribe so you never miss my weekly men's health videos. Gentlemen, have you noticed subtle changes down there as you've gotten older? Maybe it looks a little smaller, feels a little less firm, or just doesn't perform the way it used to. You're not alone. It happens to a lot of men. But here's the good news. Penile shrinkage is not inevitable. With the right strategies, you can protect, and in many cases even restore, your size and function. Myth-busting transition. Let's bust a myth right away. You've heard it before. Shrinkage is just part of getting older. That's simply not true. Age can influence penile tissue, yes, but it doesn't mean you're powerless. What actually happens is something doctors call penile atrophy, a gradual loss of elasticity, firmness, and volume. This isn't vanity. It's about function, comfort, and confidence. Empathy plus hope. When the tissue loses tone, it affects erections, pleasure, and even your sense of masculinity. But the good news? With early action, most of these changes are preventable. I see it every week in my clinic. Men worried they're losing size or noticing changes in performance. And I always tell them, it's not too late to act. Your body is remarkably resilient when you give it what it needs. Set up for tips. So today we'll unpack what's really going on, biologically, emotionally, and practically. And then I'll walk you through 6 evidence-based strategies that truly work. Habit number 1, ignoring blood flow. Our penis, like every other organ, depends on a steady supply of blood to stay healthy. Reduced circulation means less oxygen, fewer nutrients, and eventually, tissue shrinkage. As we age, blood vessels stiffen and the inner lining, called the endothelium, can get damaged, reducing flow and elasticity. Emotionally, that can create frustration or performance anxiety. Practically, you may notice less firmness or a smaller appearance. Quick fix: improve circulation naturally. And it starts with your diet. Stay tuned. Habit number 2, skipping your nighttime maintenance. When you were younger, you had 5 to 8 erections every night during deep sleep. They're not random. They're maintenance workouts for your penis. Fewer nocturnal erections mean less oxygen delivery and weaker tissue tone. Poor sleep or chronic stress can make that worse. So prioritize quality sleep. More on that in a moment. Habit number 3, every erection is like a mini workout. Men who become sexually inactive, whether from stress, busyness, or low mood, often see faster declines in size and function. Biologically, less blood flow equals less maintenance. Emotionally, it affects intimacy and self-esteem. Practically, it takes longer to get and keep an erection. Good news. There's a simple natural fix coming up. Habit number 4, low testosterone. After about 30, testosterone naturally drops 1 to 2% per year. Low T reduces elasticity, libido, and energy. Biology. Testosterone supports tissue repair and blood vessel health. Emotionally, low T can make you feel tired, flat, or less masculine. Practically, weaker erections and lower motivation. You don't have to accept that decline. There are safe ways to restore balance. Habit number 5, abdominal fat and insulin resistance. That growing waistline isn't just cosmetic. It signals inflammation and hormone imbalance. When insulin resistance develops, it damages blood vessels and interferes with testosterone, directly affecting penile tissue. Lose the belly fat, gain better blood flow, stronger erections, and higher confidence. Habit number 6, poor lifestyle choices. too much processed food, sitting all day, and not enough sleep. It's the perfect recipe for shrinkage. Chronic inflammation, low T, sluggish circulation. They all add up to smaller, weaker performance. But the fix is simple. Let's talk solutions. 6 science-backed fixes. Trick number 1. Boost nitric oxide and vascular health. Eat nitrate-rich foods like spinach, kale, beetroot, and pomegranate. These increase nitric oxide, the molecule that relaxes blood vessels and improves flow. Aim for 2 servings of greens per day. Trick number 3. Exercise regularly. Combine cardio with resistance training 4 to 5 times a week. Even 20 minutes of brisk walking or bodyweight exercise boosts blood flow and helps preserve penile tissue. Trick number 4. Maintain sexual activity, whether partnered or solo. 2 to 3 sessions per week keep oxygen moving. Frequency matters more than intensity. Consistency keeps tissue elastic and responsive. Trick number 5. Manage your hormones. If you notice fatigue, low libido, or reduced size, get your testosterone checked. Balanced hormones support blood flow and erectile health. Only pursue therapy under qualified medical guidance. Trick number 6. Smart tools and supplements. Under supervision, vacuum devices can safely draw fresh blood into the penis. Great for recovery after prostate surgery or long inactivity. Supplements like L-arginine, pomegranate extract, and pine bark extract can support vascular health. But they add to, not replace, lifestyle changes. Results vary. Some men regain firmness or a slight increase in size. Others simply stop further decline. Both are wins. What matters most is starting early, staying consistent, and keeping your expectations realistic. Your sexual health isn't about vanity. It's about your dignity, confidence, and quality of life. Every small step counts. A better diet, a short daily walk, improved sleep, or finally getting your hormones checked. Remember, age is not the end of vitality. I see men in their 60s, 70s, and even 80s enjoying healthy, satisfying sex lives because they took action. Start today. Pick 1 or 2 of these strategies and build from there. It's not about overnight miracles. It's about long-term freedom and confidence. If this video helped you, hit like, comment below where you're watching from, and subscribe for more evidence-based advice for men's health. Gentlemen, remember, your size, your function, and your confidence are in your hands. It's never too late to act. I'm Dr. Olivia Parker, reminding you to stay proactive, stay hopeful, and take charge of your health, because you are absolutely worth it.